Welcome to the SASS Support Group meeting. Today, we are talking about stoma products that are available to you. As much as we are offering advice, this advice is based on the most common scenarios, and the information is compiled to empower you, the Ostomate, to better understand and navigate your new normal. We will always advocate that you consult with your physician or your stoma nurse because they understand your unique set of circumstances better than we could. If you do need to find a stoma nurse, the South African Stomaltherapy Association, or SASA for short, have a list of registered stoma therapists on their website. Please contact www.stoma.co.za. Alternatively, contact SASS via WhatsApp on 066 261 0654 or on our website www.sasstomates.org.za.
So this evening we're going to talk about pouching systems and the different types of products that are available in South Africa, not meaning obviously that it's available in the state sector. So I think that from that point of view, discussing what is available in the state sector should be discussed with your industry partners from Hollister, Coloplast and such like. But I'm going to talk to you about what is available in South Africa, what the guidelines are that have been presented to Discovery Health in terms of product prescription. So there are many, many, many different types of products. You have got drainable products, closed products, moldable products, floating flanges, deep convexity, light convexity, post-op bags, high output pouches. So many, many, many different types of products are available in our country. Obviously, we can't compete with what is available overseas in Europe and the US, but we have quite a number of products that are in fact available to help you manage your stomas. So the types of pouching systems, I think one of the most important things we want to get across tonight is that all products are disposable. While there may be people who remove their two-piece pouch and wash it out and put it back for whatever reason they are doing so, it is not recommended. It has never been recommended. And any product that is removed, so the minute the product is taken off the skin or removed off the base plate, it is disposable. It is something that can be thrown away. And all products are disposable. What is different is whether or not you are disposing of that every day or whether you are wearing the product for a certain number of days before you dispose of it. So all products are disposable. The wear time of that product is what differs. So very often what we have requests like, I want a disposable product. All products are disposable. Generally what people are indicating when they ask for a disposable product is they want something that they can dispose of on a daily basis. But all products are disposable. One-piece pouches and two-piece pouches are the same. So you can have a one-piece pouch that is drainable, which one would wear for a period of 3 to 7 days, depending on the wear time, depending on the type of stoma you have, depending on what is draining from that stoma. Is this a formed stool? Is this a loose stool? In other words, do you have a stoma coming from the colostomy or do you have a stoma coming from the ileostomy? So those are different, and those are things that often influence whether or not you can wear that product that is one piece but closed or a one piece that is drainable. So the more frequently you need to drain the product, that would mean that you would need a drainable product. If you are only needing to drain that product once or twice a day because you have a colostomy on the left side of your abdominal wall, then that may indicate that you can use a product that does not have a drainable facility, but is rather closed and you're going to take that off every day or maybe twice a day, and you're not going to drain it, that makes it a one-piece closed daily change product. It does not make it the disposable product, okay? Because the drainable and the closed pouch are both disposable. Your two-piece products also come in drainables and in the one-piece closed and in the closed product. And again, they're all disposable. What is different is how long you're going to keep that product on your skin. So a drainable product, which is a product that you will keep on the skin for a length of time between 3 to 7 days, can come in a one-piece system or in a two-piece system. You can also get a two-piece system in the closed pouch, which means that you'd keep the base plate or the flange in place for a period of 3 to 7 days, and you would discard the pouch on a daily basis or a twice daily basis. Okay, am I being understood there? Okay, so we just need to understand that all products are disposable, and it's just the wear time on that product that differs. What is convexity? And I'm sure you've all heard about convexity, and you probably all have some understanding of when convexity is used. But the definition of convexity is defined as the curvature on the skin. So the curvature on the skin on the side of the barrier. So if you have a look at this photograph here, you can actually see the saucer-shaped indentation on the back of the barrier. And again, your convex systems may come in a one-piece, they may come in a two-piece, meaning that the convexity is then positioned on the flange or the base plate. You can get a convex pouch in a closed system as well, a closed one-piece system. You can get that same convex pouch in a two-piece system. And then if we are talking about an accessory, for instance, or in stomal therapy world, we often will refer to this as a supporting product. You can get a convex barrier or a convex seal. Okay, so that would be the seal which we would use in conjunction with the barrier if it was required. So convexity is the curvature on the skin side of the barrier or the accessory. So the convexity needs to go onto the skin around the stoma. And then we talk about accessories, necessities, or supporting products. So an accessory is something that is used, the term is used when we when we have presented at Discovery, we refer to supporting products, because Faisal is quite right. An accessory sounds like something that is nice to have or a luxury, but in fact, all of your supporting products are part and parcel of what one requires in order to adequately manage your stoma. So there are many, many different types of supporting products. You get remover wipes, you get remover sprays, you get powders, you can have all your seals, all the convex seals and the flat seals and the moldable seals and the protective seals. Those are all supporting products. And we've put a range of them out on the slide. There is the pastes, many different types of pastes. You get soft pastes, you get pastes without alcohol, you get pastes with alcohol. There are significant differences to both. There's significant wear time. So all of these products important and are prescribed and should be prescribed alongside the actual pouching system that you are using. So many, many different types. And there we are, a few more. To add to the armamentarium, we have barrier extenders, the belting systems, more removal wipes, more seals, strip pastes of various kinds, supporting belts for hernia. So supporting hernia belts. I'm just going to point out today that the photograph in the picture shows a hernia support belt with a hole in it. We do not recommend hernia belts with holes in it for the product, unless you have got a piece that can then fit over that pouching system in order to support the hernia around your stoma. So if you don't have an extra piece which can then fit over that pouching system, there should be no opening at all in your hernia support belt. So when it comes to pouch selection, this is where the expertise and the understanding of the disease process and the stoma that you have and the skin type that you have and the body shape that you have. And this is the skill of the stomal therapy nurse, okay, or the colorectal nurse. They have an understanding of how to make a selection for your pouch, and it has nothing to do with sticking. So all these bits and pieces that I see are being given to patients out there, like which is the Friars Balsam and iodine and all sorts of things, because they have a sticky texture to them and are being given to people to plaster around their stomas onto their skins so that their product can stick. That has nothing to do with your product, with the selection at all. The selection is everything to do with the assessment of the stoma, the skin assessment, the type of drainage from your stoma. So if someone has an ileostomy, for instance, an ileostomy we know drains a loose stool. Yes, it can get as thick as porridge, and that's where we want to get it. But it is a highly excoriating substance. It comes from your small intestine. So it has lots of enzymes in it. It has an alkaline pH. So remember from the discussions we've had on the anatomy, the small bowel content is an alkaline content. It is not acidic, but because the pH of your skin is slightly acidic and the pH of the skin is lower than the alkaline pH of the ileostomy content, it's going to burn the skin. So when we make a selection for someone who has an ileostomy, we need to bear in mind the type of barrier we're going to choose. We're going to make sure that it is a barrier that can withstand ileostomy content. We may need to add, again, as Faisal said, it is not an accessory, a supporting product like a seal or some extra paste, or a belt. So it's all about the correct prescription. And if one has the correct prescription for the type of stoma you have, for the type of body shape you've got, and the skin turgor, the skin, how dense the skin and the abdominal wall is, and for the content that is draining, then and only then are you going to have a situation where your product can remain in place comfortably without burning and without itching and without leaking from one pouch change to the next pouch change. So pouch selection is very, very important. And while you will always have, you should always have a say or some contribution to the type of system you use, ultimately, the selection has got to resolve back to the specialist or to the person who is looking after you, because it doesn't have anything to do with sticking. So sticking Friars Balsam all over your skin, picking up loads of tape and strapping it to your tummy to keep the bag on, to make it stick, is not the answer. So really important. It has nothing to do with sticking, but everything to do with the stoma and the peristomal skin assessment, and then making the appropriate choice of product, and then giving you as the patient the correct prescription. And it's important for you to know this, because I think very often when you find yourself in a situation or facing someone who doesn't really have the knowledge, that at least you know, and that you know that it is your right to get the right prescription. It is your right to have the correct products available for you. So those of you in the state sector, it's not about the products not being available. It's about the people who are placing the orders, not placing the orders required for the types of patients that are in that hospital. And again, it comes down to education and your support and your voice. Faisal, you are absolutely right, is what will help and support the professional in getting these products and all the right products available for you in the hospital. Because when the product is available in the country, it's not about it not being available to the state. And I know that there are certain things that are not available to the state, but there are many, many, many things that are available to the state. So the kinds of report backs that we get so often, and the types, and I see many patients from the state who will walk down the hill from Charlotte Mac to me for help. When I inquire from a product specialist or an industry person, is this product available in the state? I will get an answer yes, or I'll get an answer no, it is not available, but it is available as a buyout. That means that I can give that prescription, and that hospital, if I'm not mistaken, is then bound to purchase that product. And it needs your voice to know that. So in a stoma assessment, as I've said to you, these are all of the things that we look at. We look at the type of stoma. Are we dealing with someone who has a colostomy? Are we dealing with someone who has a urostomy? Is this urine that's going to drain out of this stoma, or is it an ileostomy? Is the stoma pulling backwards? So is it inward? Is it retracted? Or is it protruding outward? Is it an outward stoma or an inward stoma? If you are using simple terms for yourself to describe it to maybe a storekeeper, I've got an inward stoma. I need something that's going to push it outward. In that case, we need to look at something like convexity. Where is the stoma positioned? Too many of our patients out there are not having their stomas sighted. So the stomas are being positioned in all sorts of places, that maybe right out on the hip, in the waist. All of these things will impact the type of stoma pouch that you need, and it will impact the wear time. And it then dictates to us what kind of supporting products you're going to need. What is the size of the stoma? You can't squeeze a stoma that is 70 millimeters in diameter into a pouching system that only cuts to 60. So it's important that we have these availabilities to us, and the cut to fit products, which fortunately we do have in our country, are important. we look at, when I'm doing and when Dee is doing an assessment, or any other trained stomal therapy nurse, they're going to look at what your capabilities are. What is your eyesight like? How comfortable are you with a pair of scissors? Are you mobile? Do you have a spinal injury that has, maybe you have a kyphosis, which means that you've got a curvature in the spine and it's curving you more to the left, or it's curving you more to the right. Those are going to impact how you're going to apply the product and what type of product you need. And then obviously we need to know what is available. It's no good me looking on Googling to see what products are available, because I'm going to pick up all the products that are available all over the world, and I'm going to see something that I really like that's not available in South Africa. So we need to know what is the availability of products. If it's a state patient, is a convex system available in the state system? So that's important. And then most stomal therapy nurses will prescribe combinations of products. So you might use a product pouching system from company A, but we might match that with a seal from company B and a belt from company C, because that gives you the best all-round system in order to manage going forward. While patients do have a choice, you can only have a choice if you're educated to the type of stoma you've got, what is draining from that stoma, and if you know what skin type you have, etc., etc. Otherwise, you do need to deflect to your stoma care nurse so she can help you, educate you, and help you then in your choice. And then if you are really worried and concerned, you are most welcome. Anybody in the SASS group is welcome to contact any one of the stomal therapists, definitely Dee or myself. We will rather private message us if that's possible, or go onto the group, and if we can help you, we will private message you and put you in touch with someone maybe in your area or close to your area, or someone that we trust, or even, that can help you, put you in touch with someone who can help you if you are concerned that perhaps you are not having the right prescription. So the other important thing, and this we see just so often, too many people are not, because they have not been given the right instruction and don't have a good routine. So for instance, if I see a patient who has an inward stoma and maybe an inward ileostomy, so I know that they need to use a convex system because we want to push the stoma outward. It's an ileostomy, so I know they need to have an extra barrier. So I'm going to give them a seal, for instance. It's an ileostomy, the content is heavy, and it's quite a drag on the abdominal wall, especially after an operation, and that can be quite painful. So I might also add a belting system. When I place that, I know that it probably can stay on somewhere between 5 and 7 days, because most convex products, not all, but most convex products are long wear time products. So I will say to this patient, if they are already self-caring, we have put this product on Monday. I want you to change this on Thursday. And any Ostomate, for the most part, I'm not talking about the odd accident, but for the most part, should be able to change their product at set times that are convenient to them and not go from leak to leak. So I've often asked people, when do you change it when it leaks? That is not the way it should be done. But of course, you should always change a leaking pouch. So don't be tempted to tape it up, because once the seal has broken, I mean, we've talked about this in previous discussions, once the seal is broken, you are no longer odor-proof and you are no longer safe from leakage and skin damage, etc. So always, always, always change a leaking pouch as soon as you possibly can. Do an assessment, even on yourself. Have a look at your stoma. Look at the skin. And if you are worried, then please seek help. And be prepared to change the system that you have initially chosen. Because sometimes what was chosen for you in the beginning, as maybe you've got well and you've put on weight, the product may no longer be appropriate. You may have developed a hernia. You may just feel that you'd like to look at something else. Maybe you're using a one-piece system and you'd just like to look at another type of one-piece system. It is your right. And so it's very important that you keep an open mind and that you are prepared to change the system you may have initially chosen. And I know a lot of people in the last number of years, because products have come to the end of their lifetime, across the board with our industry partners, and patients have been incredibly distressed about having to move from a particular system to the system that has maybe replaced that product, or to have to look at something within a completely different range. And it is scary because people, humans, like continuity and they like routine and they feel comfortable. I mean, I don't even like changing my rooms. I mean, I had to move rooms a few years ago and I really like, oh, do I really have to do that? But when I did, I was just so much happier. So don't be afraid to change a system that you may have originally chosen for something different. It is important. And that's why your group is so important. And these kinds of discussions are important because you get to meet the industry partners from different companies. And we've already, there are other products out there, maybe, to what you've been shown or what you've been using. And I'm just going to do a small, just give you the slide on pouch emptying and how many sort of different ways in which you can empty. So preferably if you are using a product that is to be drained or emptied, it's preferable that you can sit on the toilet or stand above the toilet. It's never recommended really that you kneel on the floor, because you've got to be able to empty wherever you can. And while I know not every single loo in every public toilet is clean, it's probably cleaner than the floor. So you so sitting on the toilet with your bottom right back against the back of the loo, right back, and then emptying down the middle, using a wet wipe or some loo paper just to drain it and to clean the mouth of the bag. And that's the most important part, is to keep the mouth of the bag clean. It's not really necessary to walk around with jugs and have water and pour water into the bag. It's not generally recommended. And anybody on the group tonight that has come through my practice will know that it is not something that we recommend. So a wet wipe, a loo paper, you can even wet a more firmer paper like a tissue paper or a paper towel, just to clean the mouth of the bag. If you're using a drainable product that has a clamp closure, keep the clamp clean and maybe just renew the clamp every so often. If you're not, if you're using one of the more modern products, modern drainable products, they all have integrated closure. So you're getting a new integrated closure each time you change your bag. So you can kneel, you can sit facing out, you can sit facing in, or you can stand. Standing is sometimes easier for somebody who's maybe had their rectum removed and they've got sutures in the back, in the back area around the bottom. Then sitting is difficult, so standing would be more appropriate. But if you're too high up from the loo, you're going to get a lot of splash. So that is something just always to remember, that the closer you can get down to the toilet, the easier it is. And I'm not sure if you've ever been told this, but I'm sure you have. Remember just to put some loo paper into the pan. So just line the pan with some loo paper so that, first of all, you can avoid splash, and secondly, it makes clearing of the toilet a lot easier, particularly if you are in a toilet that maybe doesn't have a toilet brush. Then you know the loo paper will take the stool out when you flush.
On our website, for those who haven't seen it, you'll see there's a suppliers tag, and we've got the biggest suppliers that we've been dealing with thus far listed here, and it'll take you directly to their website. But also we have a link to SASA, who's Jane and Dee, in terms of finding a registered Stoma nurse. And if you click on the link, it'll take you to a list or a directory of qualified Stoma nurses. And then just again below that, links to various suppliers that's operating here in South Africa. I think it's also important to note that all of the suppliers that we have dealt with have always been more than willing to assist. They may not be able to help immediately, but they're always willing to assist where needed. The other thing that I mentioned, and it speaks to us speaking up, we have the right to do that. If you have a look on this website here, this is a chart of patient rights. So it's not the Ostomate chart of Ostomy rights, but this is just pure and simple medical rights within South Africa, and this is sitting in the Constitution, right? And I'm not going to go into detail with every one of them, but we should have access to a healthy and safe environment. We need to be able to participate in decision-making skills. We've heard stories where people didn't want the stoma and it was just thrust onto them. That's not accepted. We need access to healthcare. Obviously understanding our health insurance or medical aids. And then you should have a choice of where to go to for healthcare. So if your operation was at Tygerberg, and you live in Grassy Park, that's here in the Cape Town, that's a huge commute between the two areas. You can ask to be transferred to an area closer to you or to a clinic closer to you. And the one thing that I want to bring up, or 2 points, is the refusal of treatment. And maybe bringing this one up is a bit harsh, but there have been too many instances where ostomates are getting to clinics and they are sent back home because there is no product for them. We don't have to put up with that. We may not have it there, but we need to make a noise. We need to speak up. And the more we speak up, the more we will be heard. And the second one is continuity of care. And continuity of care is not just every month giving you your new bags. We have the right for the qualified stoma therapist to examine our stoma. We change, our body shapes and sizes change. Again, like I said, what I got prescribed when I first became an ostomate to what I'm wearing right now is completely different, not even similar. I was on a 2-piece system. I use a 1-piece system now. I change my bag daily, but that's because of the lifestyle that I live and certain complications that arose from having the 2-piece system. But I had the right to speak up and say, this isn't working for me. And that falls under the continuity of care. And as you can see, that's on the URL, it's listed as part of the Constitution. This is just a summarized version, but it's there. So you have the right to speak up. And if you need support in terms of speaking up, reach out to SASS. We've slowly but surely been getting more and more access to especially the public healthcare facilities. And slowly, and sometimes frustratingly slowly, we have started making a difference. But the more Ostomates speak up, the greater the impact we can make.
Jane, good evening, Jane, and maybe for the benefit of most people around the room, I'm an Ostomate for 2 years now, or less, just under 2 years, and I just want to find out, what is the normal? How often do you think a person should be seeing a stoma therapist? What is the usual time frame? Is it a 6 months? Is it a year? Annually? You have to go see one, or obviously as and when you have issues, yes, I realize that. But under normal circumstances, when everything seems to be going okay, but you're not sure, how often should you be seeing a stoma therapist?
Narata, that's actually a really good question. So we teach when we do our programs and teach our students, the person with the stoma who has a colostomy or an ileostomy, so someone with a fecal stoma, if everything is going well, should see a stomal therapist on an annual basis. Now, in the private sector, most prescriptions, so most chronic prescriptions or PMB prescriptions, those prescriptions are generally for 6 months to a year. So in my practice, I will renew a 6-month prescription, but when it comes to the next prescription, I need to see the patient. So an annual review if everything is going well, and it's usually a good idea to tie it up with your prescription for when the prescription has come up for review.
Okay.
A patient with a urostomy, so a patient who has a urinary stoma, should be seen twice a year, every 6 months. And the reason for that is that when a patient who has a urostomy, when they have that operation, the urinary system, the drainage system is significantly changed. So before they had their surgery, their urine was draining into their bladder and then out through the urethra, through the tube leading out onto the perineum in a female or through the penis in a male. When they have their bladders removed and the urostomy constructed, we change that system from a closed system to an open system, which makes them very susceptible to infection, and therefore their follow-up or their care, their required visits to a stomal therapist should be twice a year if everything is going well. Okay, and then of course, it goes without saying, if you have a problem. And if I get a call or a WhatsApp message from a patient, and if there are any of my patients on this group, they will know. If I get a WhatsApp that says, I've changed my bag today and I've got some burning around the skin, what should I do? I will say, do a pouch change today. If that burning does not improve, doesn't go away, if it remains or get worse, you make an appointment to see me. And so that's very, very important that you don't just keep banging on, changing the pouch, et cetera, and please don't think that your gentian violet is going to make a difference there, unless it is a one-off. So it may be, for instance, that you've eaten something that has given you a bit of a loose stool. So if you're in an ileostomy or loose stool, the looser the stool, the higher the pH, the more alkaline it's going to be, the more it's going to burn the skin. So it may be that you are not someone who eats a curry very often, but you just so love curry, and last night you had a vindaloo and you got a really runny stool, which is okay. That is not a problem. And you got and your barrier sort of melted out and you've got a bit of burnt skin, but with the pouch change, that resolved, then obviously you don't need to come and see me. If it doesn't resolve, you need to come and see us. So don't sit on your issues. If they don't change within a week or two, you need to make an appointment. And that's very often the mistake because, again, we're human and we all do it, whether you've got a stoma or you don't. We tend to ignore things. Oh, it'll get better. It'll be better next time. It'll be better next time. So don't leave things. But everything going well, if you have a colostomy or an ileostomy, an annual checkup is very important. Tie that up with your prescription renewal. And if you have a urostomy, twice a year.
Hi, this is Janine. I think firstly, I really just want to say thank you for this group, and I've never had this amount of information at the same time. I've had my urostomy now for the last 9 years, and I'm literally using the same system that I've used since the first time that I walked out of the hospital, and during this time 3 years ago. I had a baby as well. So as we know, there were stretches and movements and changes that happened. But also I would just go to the hospital, get my goodies, and there I go. Never had a question asked. And it was also so wonderful, Faisal, that you said earlier on, that myself as a patient, because when I left the hospital 9 years ago, my thing was, I'm alive. I'm grateful. Thank you very much. I've got something that supports me and that helps me on a daily basis. So I'm just going to take this and I'm going to run with it because it changed my life for the better. And now listening to the products and the feedbacks, etc. And I've got my goodies here next to me. And I'm thinking to myself, looking at the presentation as well, that's so incredible, sister. It's just, I get multiple products, but then I definitely feel, okay, some I use once and then it starts leaking again. And then sometimes even thrice a day I have to change. And now, potentially, I know that I'm not going to mention all the the product that I have here because it changes all the time. Sometimes it's multiple leaks, and I just want to know from a product point of view. Do I need to use everything, or can I, for instance, just like the barriers, like the barrier rings, for instance, because now I see there's a ring that looks like a half moon, and I've always been using like the full rings from, I think it's Brava, Coloplast. Yes, I've been using that ring, for instance. So now I also see these different products, and I can go to the Stoma Nurse and have that conversation. So I just really want to say thank you so much for this platform. It is incredible. And I'm going to definitely use my voice moving forward. So thank you so, so much.
May I respond to you, Janine?
Absolutely.
Okay, I tell you what, there are a couple of things that I've picked up that concern me, and that is that you sometimes having to change your bag 3 times a day or pouching system 3 times a day. That's suggesting to me that perhaps something has changed in the last 9 years, and perhaps you need to have your stoma correctly reassessed, because you should not be leaking 3 times a day, my angel. You should be able to keep your pouch on for the wear time of that product. And if it's a urostomy product, the wear time should be anything from 3 to 7 days. So if you are in the correct prescription, you should have that confidence to wear your product for the entire wear time. So I'm going to say to you, if you do have a qualified stoma nurse to see, please go back and see her. And if you don't and would like to know who the closest person is to you, please direct message me at your convenience. Okay. But I think from the sounds of things, you need an assessment, a reassessment, my love.
Absolutely. No, I will definitely do so. Thank you so much. Absolutely. Yes. No, having a baby and all of those changes.
Yes.
No, definitely. 2 days maximum for me to have my bag.
Good. And no, that's no good, my love. We need to sort that out for you. And I just want to make one clarification. The half moon seal that you saw is actually a flange extender. So it's, it just extends the flange so you have more grip.
Awesome. Okay, thank you so much.
Please just private message me the information that I would need, and then I will put you I'll point you in the right direction.
Fantastic. Thank you so much. And all the suppliers here it's every single piece that I've used has been incredible. It's just my body that changed, and it's going to get fixed.
It's going to get fixed. And congratulations on your baby.
Thank you.
Thanks, Janine.
Oh, hi, everyone. This is Mantebu.
Hi, Mantebu.
Yeah, I heard sister talking about the use of Friars Balsam, and I've been using that for the past 10 years. So I just need to know is there any dangers of using it? But I've been using it, and it keeps my back, like, it sticks very well. So I got a little bit worried there if I'm doing something wrong with it. And thank you so much for the information. I've learned a lot. I don't even know what kind of my stoma is. I've just learned all these different kind of stomas there. So yeah, but so far so good. I'm using Coloplast and I'm happy with it. I was introduced to this Centura Mio. It works wonders for me, so I can keep it maybe for 3 days. But sometimes I felt 3 days is too long, but I can keep it for 3 days. So yeah, I'm happy with it. So if sister can help me with the Friars Balsam business. Well, thank you so much, and I love you guys.
Hi, Mantipu. So I'm going to what I'm going to say to you is that the latest research, so first of all, Friars Balsam it shouldn't be used to make your product stick. That's not the point. The other thing is that the latest research is showing that because the barriers, so those are the actual product that sticks to the skin, they're all what we call hydrocolloids. So they are products that are specially manufactured to adhere to the skin, and they need to adhere to skin, to virgin skin. They are not required to have anything between the skin and the barrier. They actually need the skin, they need the heat from the skin, they need the oils from the skin, they need the moisture from the skin to bed down correctly. And Friars Balsam is not a product that has been manufactured to help make your barrier stick. Your barrier should be able to adhere to the skin without anything else in between. And the latest research is showing that even the barrier wipes, unless there is a really good reason to use them, for whatever reason, maybe you perspire a lot, or perhaps you live in a country with a lot of humidity. Up here on the Highveld, we don't have humidity. You should not need anything else between your skin and the barrier. But I'm not going to change what has been working for you. And I'm very happy to hear that you are able to keep your product on for 3 days. And as long as the product you are using, if the wear time of your product with the stoma and the output is recommend it for 3 days, that's fine. If you're wearing a product that is able to stay on for 5 to 7 days, then the wear time of 3 is not okay. But at least you're not having leaks and you're going from one pouch change to the next pouch change, and that's important.
Is there a Rolls-Royce of bags?
Is there, beg your pardon?
Is there a Rolls-Royce of bags? I mean, the perfect bag.
No. So I'm going to answer that, and then the companies can answer you, because I don't represent any company here. The best product is the product that works for you. So the product that works for you might not be the 2022 product. It might be, in fact, a 1984 product, or it might be a 1991 product, or it might be a 2000 product, as long as it's obviously still available. I mean, there are products that have been available in our country since 1975. And for many, 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 many people, that product was the best product. And I can tell you that for those people, many of them will still tell you, even though they are using product in the 21st century, products from the 21st century will tell you that for them, that 1977 product was better. So the Rolls-Royce product is the product that works for you. So that is, it keeps you clean and dry and comfortable. It keeps you odor-proof. It protects your skin, and it gives you the confidence to go out into the world. That's the Rolls-Royce of product.
Thank you.
Because
I have a couple of questions.
Please, Elaine.
Yeah. Hi there, everybody.
Hi.
Thank you very much, Jane. I saw you a few months ago and you put me on the right track with the 2-piece. So thank you very much.
You're welcome, Elaine.
Everything's really improved and I really appreciate it. Thank you very much.
You're most welcome.
I just, out of curiosity, I have a question about what you said earlier regarding the support belt, the thick one with the hole in.
Yes.
Why recommend that one? Because of the hole?
No, we don't. We wouldn't recommend so that is a hernia support belt, Elaine. We would never recommend a product with a hole in it unless it had that extra supporting piece over that could fit over it. But it's not I don't think it's available in this country. So we would advocate a product that is complete, so that the entire support belt goes over the bag, all right, to support the hernia, and that you don't make a hole in it to pull the bag through. The only time you can do that is if the product you are using also has the same material of support that you, like a flap, that you can then pull over the pouch. Does that answer your question? And I'll tell you why we would not ever recommend making a hole in a hernia support belt. And that is, and this is the reason. A hernia is a break in muscle where an organ has pushed through that muscle. Okay. So when a stoma is created, the surgeon actually does exactly that. He brings out a piece of your intestine, an organ, through an opening in the muscle and the skin on your abdomen. So in a sense, he is creating a surgical hernia. Okay. What happens when when the peristomal hernia forms is that through that defect, where the stoma comes through the abdominal wall, through that defect, the loops of bowel behind that push through the opening in that muscle, and they create that bulge. Okay. If I then prescribe a support belt to support the hernia, but I then make an opening in it for your bag, what I'm doing is I'm pushing the hernia out even further. And you can actually create quite a bit of damage. So when you're supporting a peristomal hernia, it needs to be a complete flat piece over the hernia. And that is why your hernia support belts are made from very, very specific fabric that allows external push out from the stoma when it functions, or when you pass winds. Okay.
Thank you.
Did that help you, Elaine?
Yes.
So good evening, everyone. So my name is Graham. I've been a long-term patient at Charlotte Matreka Academic Hospital. So for the past, say, 15 years or so, I've had a colostomy, and I've developed so well, and I'm doing so well that I've actually decided to start workouts and things like that. But let's say, for instance, we meet people that wants to join us. So my product has been working for me for the past year or so. But now when they join me in this workouts and things, do I recommend them to use my product, which is Colo Plus, or do I adjust to their products?
No, you don't recommend anything, Graham.
Okay.
Your product works for you, and that's amazing.
Yes.
And somebody else's uses something and works for them. So it's not really up to you to recommend products at all. If someone wants to try, this is the problem. You must remember that even someone who might have a colostomy like you, that is going to be different to yours, because everything about you is unique, and everything about your colleague is unique. So you might share a similar thing. So I have a colostomy and you have a colostomy, but I have got a different skin type. I might have a more oily skin. You may have a drier skin. I may have more folds than you. So product is very, very particular. It's about, that's what I said earlier, it's about the prescription. And if someone wants to change their prescription, what you could do if they wanted to change their prescription is refer them back to their stoma care nurse. If they don't have a stoma care nurse, then contact your group and say, or go on to the SASA website. So that is not SASS, but the SASA website is the professional website, because you're now linked to our group, and you will, and that will give you a list of trained stomaltherapists, and find someone that person could find someone in their area to go and have their stoma reassessed. But it wouldn't be, I would never suggest that you make any kind of recommendation for a patient, because you don't know their stoma, you don't know their background, their situation. Okay. But it's wonderful to hear that you're doing well. And I'm glad that when you say you're working out, does that mean you've started exercising again, Graham?
Yes.
Good. Fantastic. And when you say your group, is it people exercising with you? Or?
Yeah, it's people that would love to join me.
Yes.
A few workouts,
Okay. So the important thing for someone, anyone who starts working out, needs to be sure that they are healthy enough to do so. And when you're exercising with anybody who has had any kind of abdominal surgery, you need to be very, very cautious about making sure that their core is strong, before they start doing crunches and hectic things that are going to increase the pressure inside the abdominal wall, because that's what leads very often to the formation of hernia. Okay. So, but well done, and it's fantastic to hear that you are feeling strong enough and well enough to do this. Well done. Fantastic.
Sorry, guys, if I can just add on to what you were saying there, Jane, and thank you so much for that question. The question about can you share with a colleague or friend in terms of your bag? I see Sister Jane is wearing spectacles. I wear spectacles as well. And the function of spectacles is to help us see better. But Jane's prescription is not going to work for me and vice versa. And that's exactly the same thing about with the bags. We see it often, and sometimes we stress on our group. I know Jane and Dee stresses too when people start prescribing things. We don't know, as Jane says, those underlying things. So just remember, our stomas is like a pair of spectacles. No two pairs are the same. And then the question on exercise, also I've about 5-6 months after surgery, I ran my very first marathon, and I did that with absolutely no core strength. I didn't do any core workouts. Well, pretty much I had 3 weeks worth of weight training. That's when I got the all clear from the doctor. But even after that, I was very, very afraid to work the abdomen because of the one thing called a hernia. About 1.5 years ago now, I started working with a biokineticist around this. And I think the most important thing that I've learned from that is to breathe when exercising. Breathing out on the exertion and not holding, causing more pressure. Breathing plays a huge role in that. And as Sister Jane mentioned as well, biokineticist suggested, and it was a learning for him too. We started working the core from the outside in. You didn't rush into it. You don't rush into crunches. You don't rush into planking. In fact, planking is in many circles, planking is not recommended for someone with an ostomate because there's a lot of exertion. Again, you're tensing yourself up and you're creating that pressure, and that intestine can come through that weakness in the abdominal wall. So breathing is probably the biggest advice I will share for anybody wanting to do it. And then also, if it hurts, stop. And you know your hurt better than anybody else.
Faisal, you're quite right.
Thank you.
You're quite right, Faisal. And in fact, just on about 7 months ago, Dee and I were very privileged to do an amazing program on exercising post-operatively and going forward. And the whole emphasis was on breathing. It's all about breathing and the breathing out and the contraction of the muscles and the pull down of the core and strengthening that core, which was amazing because it's something that as a patient you can do literally from day one post-op.
Yeah.
So it's all about the breathing and it's all about the breath out. It's something Dee and I have discussed. We have done that. We did that course, and it's something we just don't have enough hours in the day to incorporate it completely into our pre-op and peri and post-operative care. But it's something we're looking at, and perhaps Graham, if you were able to, or I tell you what I'm going to do, I'm going to discuss it with Dee, because maybe someone like yourself, Graham, if you are doing exercises, and we can share it maybe with Faisal, we could give you the link to that program. Which would just give you a good insight into how you could go about sort of starting to strengthen the core. Because even running, while you will strengthen your core, you don't strengthen it completely. So the exercise program was actually put together by a biokineticist. Yeah. We call them biokineticists overseas. They call them sports physiotherapists, etc. So, but it's an amazing program, and we were very privileged to be invited to join it.
What you were saying, Faisal, which I totally agree with about the core. And I just wanted to share with everybody that Well, I'm fortunate enough to have medical aid, but if you do have medical aid and you can find a physiotherapist who's also trained in Pilates, I've been seeing a lady twice a week and doing that with her. And I felt very secure in that she knows exactly what she's doing. So I just wanted to share that if your medical aid does cover your physiotherapist who's also trained in Pilates, they can help you to strengthen your core. They've been a great help.
Yeah. So in fact, the basis of the program we did is Pilates. Yeah. So it's all about, it's really about breathing and breathing out and contracting the right muscles and just strengthening the core. And the one thing that we also learned, and we were absolutely blown over by it, is that you increase your intra-abdominal pressure. So that's the pressure inside of your abdomen just by standing up. It's greater. Your intra-abdominal pressure is increased greater when standing up just than doing a Pilates exercise. So just that mere movement of going from seating to standing will increase abdominal pressure, and the use of the breathing exercises to do that would reduce your intra-abdominal pressure and so reduce the risk of the hernia, which is a very common complication, unfortunately.
If I can just add to that, and I think the biggest misconception is that you need a strong core just for exercising.
No,
that's false. We day-to-day living, picking up a baby, that's a weight you're lifting. Picking up your groceries is a weight that you're lifting. We all need to know how to breathe correctly, to brace our core, and as Jane just mentioned, it's that standing, the pressure that adds. Thank you very much. Are there any other questions?
Faisal, no, I just wanted to jump in here. Speaking about Pilates, I wanted to find out, is there, would stoma therapists prescribe for one to see a Pilates specialist like you've just mentioned? I don't know, Elaine, did you get a prescription perhaps that was approved by your medical aid?
No, a stoma therapist isn't going to prescribe Pilates.
Okay.
But, Elaine is lucky. She has a physio who is a Pilates instructor. But what we would often say, so in many of our patients, particularly patients who've had major reconstructive surgery in the pelvis, we will often suggest and if they have medical aid, for them to do biokinetics for a while, to start there. Because if you start, first of all, a biokineticist has a very, very, very good understanding of the physiology of the body and the exercise and how it impacts the body. So it's a good place to start. And that most medical aids will cover biokinetics a certain number of sessions with the biokineticist. If you can find a physiotherapist who also happens to be a Pilates instructor, that's great. But I mean, as Faisal said, he started with a biokineticist. Yeah. So that's a safe option.
All right. Yeah, fantastic. Thank you so much. Sorry, Elaine, I missed that.
Sorry, I also started with a biokineticist, and then I moved on to somebody closer to home, which was a physiotherapist stroke Pilates too.
Fantastic. Thank you so much.